Welcome to the YouTube channel of Sibia Medical Centre. I am Dr. Sibia, Director Sibia Medical Centre. We have a very important issue to discuss. A few days back, a young promising singer, Krishna Kumar Kunt, just 53 years old, died. He was performing in a concert at Calcutta. During the concert, he felt a bit uneasy, but he continued with the concert. After the concert, he went to his hotel room at around 9:30. In the next few minutes, while pulling his chair up, he fell and he had a small injury on his head. After a few minutes, he became unconscious. At around 9:40, he was taken to the local hospital where he was pronounced dead. What happened? Why it happened? Could something be done to save him? Could the situation have been avoided? These are the questions which come to everyone's mind. Nothing could be known till the post-mortem report was available. The initial post-mortem report is indicating that he died of a massive cardiac arrest. He had severe coronary artery disease. He also had some liver problem. Now, what actually happened and how it could be saved? It was thought that he never had a heart problem. But later his wife informed that he was having regular acidity, for which he was on regular antacids. Antacid tablets were found in his pocket and also in his hotel rooms. Now what happened is that he was feeling acidity, which he thought is due to abdominal problem, indigestion and all, but it was actually due to heart problem, which he ignored unknowingly. Had he got a medical checkup done earlier, maybe he could have been saved, maybe he would have survived. The message for everyone is, even if you do not have a symptoms of heart problem, everyone must have a regular annual checkup. A regular annual checkup is important for all of us, especially after the age of 40, especially if there's a family history of heart disease. There are persons in the family who have had a heart problem, like father, mother, grandfather, grandmother, brother, sister. If they have had a problem, then we are more likely to have a heart disease. Or if we are overweight, stressed, our eating habits are not good, we lack exercise and such things, we have blood pressure, diabetes, these are the risk factors for heart disease. So if you have any of these, then you must have an annual checkup. And if you don't have them, even then, an annual checkup is always helpful. If an annual checkup had been done, maybe we would not have lost this young, promising singer who had more than 300 jingles before he entered Bollywood. He sang in several languages, Hindi, Malayalam, Tamil, Bengali and a lot of others. But today he is no more. If he had the annual checkup done, we are likely to have detected the heart disease in time and saved him. After the checkup, after early detections, maybe he may not have required angioplasty, stent and bypass. Even non-surgical treatments like natural bypass, EECP, ESMR, Artery Chelation Therapy, maybe even they would have helped, or a change in his lifestyle could have helped. But unfortunately, he is no more, and all we can say is that he has left a message for us to look after ourselves and to have a timely annual checkup. Acidity is a common problem and often we ignore it. We must not ignore acidity, especially if it is persistent. We must have a checkup, we must consult a doctor because only a doctor can really tell you if you have a heart disease or if it is simple acidity. If it is heart disease, then timely action can be taken. Acidity and heart problem can both present in the same way. Both can have a central chest burning or upper abdomen burning or burning in the throat. Both heart problem and acidity can present in the same way, and it is very easy to confuse between the two, and mostly we think it is simple acidity, whereas it could be heart disease. And consulting a doctor may lead us to a better conclusion. What is it? Is it heart disease or is it acidity? And once that is diagnosed, it will put us on the proper line of treatment. So what KK had was actually heartburn and not acidity. If this was differentiated in time, maybe he would have survived. Thank you. Thank you very much.